Good evening, I'm Roma Villavicencio. Thank you for joining us for our Wear the Gown special. KENS 5 has teamed up with University Health for this community initiative to save lives. In the next 30 minutes, we'll be discussing a variety of health issues and the importance of taking care of yourself this season, like how to keep your children healthy in the midst of all the seasonal illnesses like RSV. What are some preventative measures? Well, I sat down with a doctor who explains it all. Plus, we're discussing the importance of maternal health from prenatal care to breastfeeding to mental health care for new moms. And are you one of the many people who have trouble sleeping? Well, we're talking to a sleep specialist about why your body isn't getting the proper rest and what you need to do to get back on track. Let's start off with what everyone is getting ready for, those fun holiday parties, and that means more opportunities for unhealthy eating and drinking. KENS 5 reporter Jeremy Baker explains how this time of the year can be especially hard for diabetics.
Food is one thing we all have in common, particularly with carbohydrates. But for diabetics, they can cause a problem with blood sugar.
We need them, but at the same time, especially having those conditions, we need to be a little more careful about how much we have at one time so our blood sugar doesn't go too high.
Carly Hill is a registered dietitian and diabetes educator with the Texas Diabetes Institute within University Health. She says you need to stick to the good carbs.
2 slices of toast would be 2 sources of carbohydrates. Fresh fruit not only has fiber, but it is a source of natural carbohydrates.
But Hill says the biggest culprit this time of year are sugary beverages like sodas and juices.
I like to refer to these as liquid candy because they're truly just made up of just sugar.
The CDC has these tips for healthy eating during the holidays. Have a holiday-proof plan when you know unhealthy options will be all around you. Outsmart the buffet by grabbing a smaller plate. Fit in favorites but have a small serving. Get moving by taking a walk after each holiday meal. And get your Z's, which makes it easier to control your blood sugar.
Life is meant to be enjoyed, but at the same time, it's just one day, not a whole week and not a whole month.
Those were some great tips, and here are some more tips on how to keep your children safe this season when it comes to respiratory illnesses and vaccines. I sat down with a doctor from University Health and UT Health who explained more. Parents watching right now, you're going to want to pay close attention. We have some very helpful information with Dr. Dina Tom. She is a pediatric hospitalist with University Health and UT Health. Thank you so much for being here.
Thank you for having me.
So this is an important topic because this time of the year, there's a lot of respiratory issues going on with little ones. What should parents be looking out for?
Yes, so we are seeing a lot of admissions to the pediatric hospital right now for RSV and adenovirus and rhinovirus. These are very common pediatric diseases that happen in the winter time and usually hit kids under the age of 2. So really the signs and symptoms of those are that your child starts to have cough, runny nose or congestion, some increased work of breathing where they're breathing hard and fast, and then maybe not eating well or not sleeping well.
So at what point does a parent say, I have to take them to the doctor to be seen?
You know, we tell parents if you are worried about the way your child's breathing, if they're breathing really hard and fast, if you're worried that they're not eating enough or peeing enough, right? Those are big signs for babies. Or if you're worried that they don't look right, they're sleeping too much, or their fevers are high.
Okay, and what do you recommend? Is there a vaccine for this or for these other illnesses you spoke about? What could parents do?
So viruses are notoriously those diseases that your body heals on its own. So there really aren't many vaccines that protect against these types of viruses. However, we're very excited in pediatrics because there are some new vaccines that have been approved for RSV. One is approved for pregnant women in order to protect your newborn babies. So that's one thing to ask your doctor about. The other thing is an antibody type vaccine for babies under the age of 2 years old who are going into a winter season. So we're very excited, and this is something to ask your pediatrician about because those are the kids who end up in the hospital.
What is the age range of children that are eligible for those vaccinations?
So if your baby is premature, if they were born premature, ask your doctor because there has long been a vaccine that we use for premature babies that helps protect them against RSV. The 2 new ones, one is for pregnant women, and that is for women who are between 32 and 36 weeks pregnant. And the reason it's important is because that protects your newborn baby. And so your newborn otherwise may not be eligible, depending on the time of year, to get that vaccine. So that's a way a mom can protect her baby. Another important age to remember is if your baby is going to be less than 8 months old during the winter season, then please make sure to talk to your pediatrician because they can be eligible for this very important life-saving vaccine.
Is there anything else kids can take, foods? I know you said sometimes they're not so hungry during this illness, but is there something that parents can give their kids to help out a little bit?
Yes, we usually tell parents, if you're a breastfeeding mom, keep breastfeeding because that is protective for babies to get sick. The other thing that's really important is just making sure they're hydrated. So if they're too young to get other types of liquids, Pedialyte is very safe. So going to Walgreens HEB, the generic one is totally fine. If they're not taking formula or milk, then you want to push hard on the Pedialyte.
Okay, and then, people watching might think, you're giving us amazing tips, but they also hear that there's a shortage of the vaccine. So what should parents do if they face that situation?
Yes, this is a very good question because we're seeing that in the hospital, we're seeing that in our city and nationwide also. So most likely your pediatrician has doses of the vaccine. So just bring it up with your pediatrician and they can talk to you about your child's specific risks and whether or not they are good candidates for that vaccine.
As you can see, RSV is something you should not take lightly, especially for parents of newborns and toddlers. Jeremy Baker has some staggering statistics on this illness.
RSV has a season that runs from September to January and affects the respiratory system, especially when it comes to young children.
When we are born, we have very small airways, so these virus can affect those tiny airways.
Gabriel Madrano is an OBGYN for both University Health and UT Health San Antonio. He says there's now an RSV vaccine for pregnant patients.
We can now offer this vaccine to pregnant patients from 32 weeks of pregnancy to 36 weeks of pregnancy.
The National Foundation for Infectious Diseases says in the U.S., when it comes to kids under 5 years old, RSV leads to over 2 million outpatient visits, up to 80,000 hospitalizations, and up to an estimated 500 deaths. That's why the vaccine that's given to the expected mother is very important.
The immune system of the mom will make the ingredients to pass the immunity to the baby. It is safe, and the side effects of the vaccine will be very similar to other vaccinations. Pain on the injection site, a little bit of muscular pain, soreness.
Madrano says most healthy people are able to get rid of the illness on their own.
Infants or the elderly with not such as strong immune defenses can get complications leading to hospitalizations and death in rare cases.
Madrano also told us not only should you get the RSV vaccine to protect your child, but also to protect family members whose immune systems may be compromised.
Important information for expecting mothers. You're going to want to stay tuned because after the break, we're discussing pregnancy health and learning ways to keep mommy and baby safe and healthy. If you'd like more information, we have a website for you to visit, wearthegown.com. Doctors say when a pregnant woman has at least one health problem, their pregnancy can be termed high risk. Jeremy Baker finds out what expecting mothers should do to help ensure a smooth pregnancy.
The CDC says Texas ranks 6th in the nation when it comes to high-risk pregnancies. That's why the entire pregnancy needs to be monitored closely from conception to the birth of the child.
It's important to discuss your birthing plan with your healthcare provider prior to going into labor if you can, so that you can make a plan with them, understand things offered to you in the facility you're going to deliver.
Allison Moreno is a University Health maternity nurse. She says when you're in the late stages of labor, moving around is important to help position the baby properly for birth. This bed bar and bars throughout the mother's room and bathroom are just one thing mothers can use.
Move around, squat, use different positions so that can be facilitated, and it also really helps with pain control to not be stuck in one position.
Women planning to become pregnant need to know their blood pressure, cholesterol levels, blood sugar, and family health history. Emotional support is important too.
To plan ahead for that, who you would want with you by your side, helping coach you through your labor process.
To reduce stress in a high-risk pregnancy, listen to your baby's heartbeat for a source of comfort and support. try breathing through meditation, be intimate with your partner through bonding exercises, and talk to your doctor about any concerns you may have, including whether or not to use an epidural.
When you're in labor and you're going through the labor process, if you end up deciding that you want an epidural, we can facilitate getting your epidural as long as it's not time to start pushing and have the baby right in that moment.
For more information from University Health to keep the mother and baby as healthy as possible, we have links with this story on KENS5.com.
What a beautiful blessing when a baby is born. And although all eyes are on baby, we do tend to overlook mom. I sat down with Dr. Patrick Ramsey with University Health and UT Health to talk about how to care for her too. If there's women in our audience who are so eager to get pregnant, this is a really special segment for you because there's a lot of information you may want to consider. I'm with Dr. Patrick Ramsey. He is a high-risk pregnancy specialist with University Health and UT Health. Thank you so much for being here.
Thank you for having us.
This is an important topic because women, they dream of having their babies, but there's a lot that goes into it, including prenatal care. Tell me a little bit about that.
So it's really important for a woman to come in early in pregnancy so we can assess if there are any risk factors she might have for complications during the pregnancy, as well as things that might evolve during the pregnancy. Developing diabetes in pregnancy, blood pressure issues may evolve, and then evaluating the baby as well for potential birth defects, growth problems that may emerge, and then coming up with a nice, clear delivery plan so that the patient has a good understanding of what the delivery might look like when it actually happens.
And what are some of those risk factors? You mentioned diabetes and those things, but are there any pre-existing conditions that women may have that could affect the baby?
Sure, certainly diabetes, high blood pressure, lupus, other conditions, and just being over age 35 is considered a risk factor to have babies with potential genetic problems or birth defects. So we want to make sure we get patients in early enough that we can evaluate for those risk factors and offer ultrasound screening.
And I understand each diagnosis may be different for a high-risk pregnancy, but in general, what kind of lifestyle do you recommend? Is there anything women can do to keep their baby safe?
Sure, in pregnancy, just being active, healthy, doing the normal things, healthy diet. Shouldn't try to diet during pregnancy, but just eating healthy and just the normal day-to-day activities.
Well, thank you. There's so many mamas in our audience,
Exactly.
so this is so important. After a mother has given birth, there's so many things going on in their mind, but number one is keeping that baby nourished. So why do you recommend breastfeeding?
So breast milk is the best nutrient for the baby. It has all the right ingredients to make the baby grow big and healthy and strong. The benefits for the baby are immense, preventing ear infections, preventing development of asthma, GI infections, respiratory infections, and long-term, reducing the risk the baby might develop diabetes and diabetes later in life, obesity. So really, breastfeeding is absolutely important for mom to consider.
Doctor, I know there's a lot y'all have to offer here at the Women's and Children's Hospital, the new facility that you're so excited about, so women can come here and get some care.
Absolutely. This is a spectacular building. It is beautiful. It has state-of-the-art features for moms, babies, and children, and we're really proud of it. We have a number of great resources here. We have a child life program for our children if they come to the emergency department or need care here. They can reap all the benefits of that program. We have a mother's place where moms who deliver here can store their breast milk while they're here and then take it home when they go. From the mother's side, we have a great team of high-risk OB specialists and OB specialists here, in addition to other specialists that can help care for moms with any pregnancy complication, in addition to any women's health issue.
According to the CDC, about 1 out of every 10 babies in the U.S. is born premature or before 37 weeks of pregnancy have been completed. Here's a closer look at risk factors and ways to keep mothers and their newborns healthy.
There are 3 categories of premature birth, starting with late preterm, which is any birth before 37 weeks, moderate, and extreme prematurity, which goes down to 23 weeks.
Sometimes mom will have an infection, dehydration. Sometimes if she's had previous preterm deliveries.
Monica Garza-Vickery is a registered nurse in the newborn nursery at University Health. She says there are many risk factors.
Moms that are older than 35, any moms that smoke during pregnancy.
According to the CDC, as of 2021, 1 out of every 10 infants in the U.S. was born prematurely. The rate of preterm birth among African American women was near 15%, for Hispanic women near 10%, and for white women 9.5%. Here in Texas, the premature birth rate is higher than the rest of the country, with 1 out of every 9 infants born prematurely. Premature babies could have many extra medical needs, including respiratory support.
Breathing may need to be assisted by a machine, the ventilator.
Maintaining temperature.
We can regulate their temperature and make sure that all their systems functioning as well as possible.
Extra monitoring of heart issues.
Because they hadn't had that time to develop properly.
Nutrition often given through IVs and a condition called NEC.
NEC is an issue with babies' intestines where they lose blood flow.
Having kids can be exhausting, and many parents are part of the many who don't get proper sleep. After the break, we'll learn more on how you can develop better sleep habits. If you'd like more information, we have a website for you to visit. That's wearthegown.com. Sleep, stress, and weight. Most of us think about them separately, but KENS 5 reporter Jeremy Baker explains how all three are related and how to keep them all in check for your overall health.
We all deal with stress differently. Many stress eat, others lose sleep. The key is keeping all three in balance. When it comes to chronic sleep problems, your metabolism can be affected by cortisol levels in the body.
So if you are carrying those high levels of cortisol into sleep, and this is going on for long periods of time, we do think it starts to affect your circadian rhythm.
Elise Vader is a physician's assistant with University Health. She says stress can also be stimulating, keeping you awake.
You're lying in bed and you're worrying about everything that happened today or everything that you have to take care of tomorrow, it's probably going to prevent you from falling asleep.
So how much sleep do people really need? The Sleep Foundation says infants up to 12 months between 12 and 16 hours, including naps, toddlers up to 2 years, 11 to 14 hours, preschool kids up to 5 years old, 10 to 13 hours, school-age kids up to 12 years old need 9 to 12 hours of sleep, teenagers between 8 and 10 hours, and adults about 7 hours or more. To help improve your sleep, create a more relaxed mental state, have a healthy diet, avoid alcohol, avoid smoking, and make sure you have some type of exercise.
Being social, going out with family and friends, that seems to reduce levels of stress.
Vader also says if you are constantly waking up and still feeling tired throughout the day, or think you may be suffering from sleep apnea or restless leg syndrome, that's when you should consider seeing a physician.
If you think you suffer from sleep apnea, I sat down with a doctor with University Health to talk about what complications one can face and how it's treated. Sleep is essential to the overall quality of our lives, and if you want to have a good one, I think I'm in really good company right now. I'm with Dr. Suhaib Haq. He is a physician and sleep specialist at University Health. Thank you so much for being with me.
Thank you for having me here today.
So there's so much to cover because there's so many age ranges and time hours that people should get of quality of sleep. Can you give me a breakdown as to exactly what ages and what hours everyone should get of sleep a night?
Yes, so CDC has recommendations for each age group, starting from newborns to toddlers to preschooler, then school kids, teens, adults, older adults. We usually start seeing issues when people are in their teenagers and moving down. In school age, probably 9 hours to 12 hours. In high school, 8 hours to 10 hours. And in adult, 7 hours or more is recommended. In older people, there may be a need for a little bit more sleep, between 7 to 9 hours. But anything under 5 hours is not considered safe.
And why is it so important to get those hours of sleep that you recommend?
Sleep is when our body relaxes, repairs, replenish, rejuvenate. So the quantity of sleep and the quality of sleep, both are very important to keep a healthy balance in your life. If you're not getting good quality sleep or you are short sleeping, then you're not going to get all the benefits that you need from the sleep.
Which probably good energy, right? And just being able to go take the long days that you need to work or exercise at the busy lives everyone lives.
A good quality sleep would make you prepared for the next day. Your focus, your concentration is going to be great. You'll have more energy. You can think more clearly. A good night's sleep gives your heart, your blood pressure system the rest it needs to be ready for the next day. Poor sleep leads to all the negatives in health.
All of that makes perfect sense, doctor. but there are people who really struggle with sleeping and they might not even know it. What is sleep apnea exactly?
So all of us, when we sleep, our body relax. In a lot of people, the muscles in the back of the throat relax, or the tongue relaxes and it falls back, obstructing the airway. When this happens, a person is sleeping, but they start to kind of choke in their sleep. And that causes the oxygen levels to go down. And when this happens, that causes the whole body to go into a state of stress. And this is what sleep apnea does. Every night when these people who are suffering with sleep apnea, they have these sleep apnea episodes. They can't breathe, their blood pressure gets out of control, they have poor attention during the day, they cannot focus, concentrate, stay awake. And untreated sleep apnea leads to heart conditions, diabetes, depression, worse of it all, accidents.
It's very dangerous, sounds a little bit scary, but is there treatment for it?
We are very fortunate that we have many different modalities to treat sleep apnea based on the severity and what is more convenient for the patient. Most of the patients do qualify for CPAP machine. That is the gold standard of treatment for the most part. It treats from mild to severe sleep apnea. They are what we call mandibular advancement devices or oral appliances or dental devices. This is also a very good treatment for people. And then we have nerve stimulators that some of them can be implanted in the chest under the skin, and they run a wire. And basically it pulls your tongue forward during your sleep. And a new technology just came out, and that is a muscle stimulator. It's a device you put in your mouth during the day, and it strengthens the muscles in the back of the throat. So at night, those muscles don't collapse easily. Positional therapy is always good that you try to sleep on your side. Most of the patient, their sleep apnea is worse when they're on the back. So if you sleep on your side, that will automatically help you.
Well, thank you for clarifying all of that. There may be many factors, though, aside from sleep apnea, that people aren't sleeping well. So what does stress, sleep, and weight have to do with one another?
Good quality of sleep and good amount of sleep is very monumental for the mental health. There have been numerous studies, and we can see around us people who have poor quality of sleep or poor quantity of sleep. They tend to stay in a mood when they're more irritated, more upset, and unable to focus and concentrate. And all of these lead to this increased level of stress. We know from all the data we have is that people who don't sleep enough or their sleep quality is poor tend to gain more weight, because poor sleep is related to release of hormones that are called ghrelins that increase your appetite. And also people tend to eat more unhealthy with that. So let's take this example as sleep as your investment in stocks. So if you invest in your sleep now, you're going to get great returns on your health down the road.
As you've heard, sleep is what we need, but many of us don't get enough of it. Here's Dr. Suhaib again and Jeremy Baker talking about the different stages of sleep.
The American Sleep Association says as many as 1 in 5 people suffer from a sleep disorder. That's why diagnosing it with a sleep study, which usually only takes 1 night, is so important.
Sleep study helps us diagnose many sleep-related breathing illnesses, sleep-related movement disorders, insomnia, restless leg syndrome, sleep-related seizures, and many more things.
Dr. Suhaib Haq is a family physician and sleep medicine specialist with University Health. He says sleep is a must to help our bodies relax, repair, and replenish.
Anybody who has poor sleep or any health condition that interferes with good continuity of sleep will end up waking up the next day tired.
There are 4 stages of sleep. The first is non-REM 1, where you are falling asleep, which lasts a few minutes. Non-REM 2 is light sleep and typically lasts about half an hour. Non-REM 3 is slow wave sleep and is the deepest sleep state. The last stage, REM sleep, is your primary dream stage. In a sleep study, sleep apnea is often diagnosed.
Our technicians may connect them to the CPAP or a BiPAP machine to help them breathe and alleviate their sleep-related breathing disorder.
And if a patient is concerned a sleep lab won't be the best environment for them to sleep comfortably, Dr. Hawk says not to worry.
Our sleep labs provide an environment where you can have a comfortable sleep, although it's not as same as your regular bed, but our staff makes sure of it that you're comfortable.
If you'd like more information, we have a website for you to visit. That's wearthegown.com. Thank you so much for joining us. We hope that you enjoyed our special and hope it will encourage you to get healthy and be more aware of some health issues. On behalf of KENS 5 and University Health, I'm Roma Villavicencio, reminding everyone to wear that gown.